A saccular or Charcot-Bouchard aneurysm we can compare and contrast them in a few ways. The saccular aneurysms arise at branch points versus the Charcot is associated with more chronic hypertension or diabetes. Saccular is oftentimes occurring in our anterior communicating artery or the anterior cerebral artery junction, where Charcot is at our lenticulostriate vessels. And saccular, we see the rupture leading to a subarachnoid hemorrhage. You typically don't see as many focal neurologic deficits versus a Charcot rupture leads to a lacunar hemorrhage where you do see pretty significant focal neurologic deficits. In a posterior communicating artery aneurysm with our posterior communicating arteries here and here, you'll often see a oculomotor nerve, cranial nerve 3 palsy. You'll see dilations at first of the pupil, and then a pupil that moves down and out, as well as ptosis of the lid, a drooping lid. For an anterior communicating artery aneurysm, more common than posterior, you'll have effects with the optic chiasm, and you'll see a bitemporal heminopsia. So both sides of the temples, heminopsia. These are looking at our saccular or berry aneurysms of the circle of Willis. Most common anterior communicating, then middle cerebral, then posterior, then basilar tip. Ischemic hypoxic encephalopathy is a critical brain injury due to lack of oxygen and blood flow. Brain damage occurs from a combination of ischemia and hypoxia. It is more common in neonates and adults during heart attack, respiratory failure, or severe hypotension. In neonates, you would see poor tone, weak cry, seizures, and maybe even a coma. In adults, you would see an altered mental status, unconscious state, or a post-arrest coma. The lack of oxygen and glucose disrupts ATP production, leading to neurons dying, cerebral edema, and blood-brain barrier becoming disrupted, which affects more vulnerable regions like the cerebral cortex, hippocampus, and basal ganglia. Lots of different etiologies. Cardiac arrest would be probably one of the more common. Asphyxia, especially if it happened during birth, could potentially lead to this as well.